Hi everyone, Lisa here from the channel Lisa Firefly. Today I want to talk about what to bring to the hospital for your jaw surgery. I'm currently at about the 7.5 week mark post-surgery. So I'm still talking a little bit funny, still have a little bit of swelling, but it has gone down significantly, and so this is kind of how a person will look and sound at about this mark, almost 2 months. So you'll probably get some literature and a list of things to bring to the hospital, but in case you don't, I just wanted to tell you a little bit about what I brought. I just brought a little case like this with my name on it, so you want to label everything. And some of the things that I brought that you might not think about: an eye mask. So you'll likely stay the night in the hospital, so sometimes they leave the lights on, sometimes your nurse might turn the light off, but I brought this just to keep the light out. Earplugs, because hospitals can be noisy and you never know how many patients are going to be there, so bring some earplugs. If you wear glasses, don't forget your glasses case, and I had put my name on it as well. Lip balm. So this is Lucas's Pawpaw ointment. I ordered a whole tub of it from Amazon. It's awesome. So you definitely want to have something for your lips, and also Q-tips. I brought my own. The hospital will likely have Vaseline and Q-tips and put some on you, but I like to use my own, and my husband was there and he was super cute and putting on my lip stuff for me. So very cute. And then I also brought some Saline Spray. They will likely give you some as well, but I brought some of my own just in case. So I just put that all in a little case. Obviously you'll want to bring your phone, and I wasn't feeling super up to updating anybody, but I did get a lot of texts and emails from people, and so it's kind of nice to see that from people. One other thing that you'll want to be aware of is just wear loose, comfortable clothing. I just brought a pair of sweatpants, a button-up or zip-up shirt, just because some people might feel a little uncomfortable putting a shirt over their head for when you go home. And I just wore flip-flops. My surgery was in September, so it was still nice out. You're basically just going from the hospital to the car. But those are some of the main things. A couple other things: hair elastic for those of us who have long hair. You might want to have it up and out of your face. Some people suggest bringing like reading materials, a magazine or something like that. I didn't. I was not in any state to wanting to be reading. You're really just going to be resting and trying to get a little bit of sleep, especially if you're staying overnight. Couple of tips for the way home, depending on how long you have a drive. I would bring a pillow, and I would also bring a squeeze bottle with a bit of water in it for the way home. Other tips for when you're leaving the hospital: they're going to give you some things, hopefully. So hopefully they'll give you some ice packs and syringes, maybe those little cardboard little containers that people can spit in. I would take what they give and ask for more, and those large syringes, you're going to be on liquid only diet for about a week, and so they don't last very long. They're plastic and they eventually get too hard to pull, so try to get as many as you can and see if they even have bigger ones. They gave me 30 milliliter ones. I heard that there are 60 milliliter ones as well, so just take what you can get from them. One other tip for your way home: you're likely going to get a bunch of prescriptions for antibiotics, maybe for your painkillers, things like that. One thing that we ran into is you're going to have to stop and get these prescriptions filled because you need your medication for when you get home. So we stopped at a pharmacy, and one of the things that we ran into is make sure that before your surgery you go to your local pharmacy or wherever you're going to be filling your prescriptions, and just make sure that you give permission for your caregiver, whether it's a spouse or parent, or friend and just see if you can authorize them to pick up your prescriptions for you. This might not be an issue depending on where you live, but you don't want to be having to go into the pharmacy to pick it up yourself. You're not going to be in any state to be doing that. So those are some tips. Comment below if I've missed anything or if you have any questions. And best of luck